Namaskara, very good morning. I am Dr. Vijay Kumar. I am a professor of cancer surgery at YENEPOYA Medical College, YENEPOYA University. Formerly, I was the professor and the director of Kidwai Memorial Institute of Oncology, Bangalore. Thank you for inviting me to give this short note on robotics. Robotic surgery has come into existence for the last 20 years, and Intuitive was the first company to bring out the Da Vinci system, and they have got now more than one generation. What we have got in YENEPOYA Medical College Hospital is the third generation called SI system of Da Vinci. One may be wondering what this robotics is all about when it comes to healthcare. Some are thinking it is like a computer which is operating. Some are thinking that it's a machine which is entered into the abdomen and operating. For those of you, to make it very simple, robo is like my slave. I put the arms and connect it into the system, and I have to sit in the console and operate. When I move my right hand, the robo's right hand moves. When I move on my left hand, the left hand moves. In other words, the robo is not on its own. I have to make it work the way I want to, and hence it is very safe. It is not going to do anything on its own.
Robotic arms helps the surgeon to do more precise surgical work, because each time a movement is done, if a 1 centimeter movement is done, the robotic arm will only move 1/3 of it. So when we move it, when the knife is moved for 1 centimeter inside the abdomen, the robotic arm will move only 0.3 centimeters. So this way the precision and the magnification helps the surgeon to do better surgeries, more precise. And the second importance is that we need not open the chest or the abdomen to do these surgeries. We can just send the arms of the robot into the abdomen or the chest and do the surgery. And doing the surgery is done sitting on this console. This console has 3D viewing thing. When we put our head inside, we can see, once the arms are sent inside, we can see the whole part here. It's a 3D image that we see, and these are the hand pieces through which we are able to move the robotic arm inside the abdomen or the chest. And the robotic arms, we can look there, and the robotic arms are now being put into the patient's abdomen to do a gynec procedure to remove a tumor in the abdomen. So these arms will go into the abdomen, and they are controlled from here by a surgeon. So this surgery is not done by the robot. This surgery is done by the surgeon with the help of the robot. The robot is we control the robot completely to do as we think how it has to be done. The benefit of this surgery is that I kept telling you is the magnification and the scaling down of the movement gives much more precision.
Second thing is, this technology was very costly when it was introduced, but there are more than one companies have now come inside, thereby we are bringing down the cost of the treatment very much. Coming to the YENEPOYA Medical College Hospital, being a university-based hospital, we get around 90% of our patients below poverty line people, and we are able to do justice to them by doing it free of cost, and we get reimbursed from the Ayushman Bharat Arogya Karnataka scheme, which is a government scheme introduced by both central and state governments. So we get reimbursed from them. In simple English, the patients do not pay a pie for getting this high-end, high-standard treatment. It is free of cost. The next question would be how it is superior to the conventional treatment. Conventional treatment in cancer, for example, is the same as what we do in the robotic program. We don't change the treatment for the sake of robotics, but we are better off with robotics because of its visualization. It is 10 times more when compared to the normal eye vision, and it is so precise that we are able to see clearly as though we are sitting inside the abdomen. That is the advantage of the robotic surgery. At the end of the day, for the patient, it is not only safe but cosmetically and functionally better, because we are able to do these surgeries with the 3 or maximum 4 holes, which are not even more than 1 centimeter hole. Hardly you can see the scar. Whereas in the conventional surgery, we will have to do the same surgery, means we have to place at least 10 to 15 centimeters long incisions, then only we will be able to enter the abdomen and do it. So having said the cosmetic part of it, the functional recovery, these patients can go back home on the 4th or the 5th day, even though they have undergone major and supramajor surgeries. Whereas when you do an incision of 10 to 15 centimeters, the recovery is slow, and hence the hospitalization is more time, and they go home much later. These are some of the advantages of robo surgery, and one of the most important thing is comparing that with the laparoscopy, which is already there for last 20 years. We do both laparoscopy and robotic surgery. In a simpler way, it may mimic the same, where in the sense small holes for the laparoscopy also, robo also. Whereas the robo has got a better magnification and precision, and it is surgeon friendly, so we can do it much more clearly, and also the dexterity of the instrumentation etc. is much more finer, and hence as I said, the recovery is faster, blood loss is less. These are the advantages of using robotic. Coming to YENEPOYA Medical College, where we are using it for almost 6 years now, we do all forms of robotic surgeries. In the chest area, we do esophagus, that is the foot pipe cancers, and the lung cancer. Coming to the abdomen, we do routinely the intestinal surgeries like rectum and colon. And coming to gynecological cancer, we do the endometrial cancer and the cervical cancer. And we also do the urological procedures like kidney cancer, prostate cancer, and bladder. All these tumors and cancers are treated effectively by using robotic procedures, and we have done more than 600 cases till now, and so we have got maximum experience and expertise, and more importantly, I reiterate, the below poverty line patients get it free of cost. Thank you very much.